you for just taking a few minutes of your time. I'm not going to keep you that long, and I'll try to get through this as quickly as I can. But today, what I'd like to really talk about is AIDIT, and what does it mean to you all as a pharmacy group, and then really talk about some other things on how you impact the patient and the patient experience when you are up and about doing counseling or you're doing whatever it might be, how that impacts the patient experience. And then we did just talk about today earlier with the leadership group is huddles, and what does huddles do for you as a department, and why is it important. So first off, let me do my quick AIDIT so you know who's in front of you today. My name is Debbie Court, and I'm with the Studer Group. I've been with the Studer Group. I'm going into my 3rd year. I am a nurse by background. Have my master's in nursing administration. I've been in some form of nursing leadership for the past 30 years. I've been everything from a director to a chief nursing officer. And as a chief nursing officer, I was fortunate to also have the pharmacy report to me when I was in that role. And as a director before, I also had pharmacy report to me. So I understand most of your idiosyncrasies that you have and some challenges that you have as well. But I also understand how you can actually impact the patient on a daily and regular basis. So I've been here now for, it's right around a year that I've been coming to Great Plains, working with the different teams, from leadership to nursing to some other areas as well. And it's been great. I've had a really great experience coming here. It's always fun to be here, even though it's freezing cold outside, because I live in Orlando, so it's a little chilly here compared to Orlando. But I'm happy to be here. So this is not just me talking, this is going to be you interacting a little bit too. And if I know anything about pharmacists tend to be a little more reserved, a little less, boisterous, but I'm going to challenge you all just to add in and ask questions. If something's not making sense, you're like, oh, we know this stuff, we got it, please stop me, because I don't want to also waste your time. Time is valuable. So let's talk a little bit about AIDIT. What education have you gotten on AIDIT in the past? Who knows what AIDIT stands for? Go for it. What does it stand for?
So it's acknowledging the patient, saying hello, welcoming them, telling them who you are, what your position is, letting them know how long approximately that you need to talk to them, what you're going to talk to them about, and then just seeing if there's anything else that you can do for them and thanking them for whatever it is that you're speaking to them about.
Okay. What about the D? What does D stand for?
I can't remember.
Duration. Duration. It stands for duration.
That's what I said, let them know how long you're going to be there.
I love it. I love it. There. Oh, let them know how long you're going to be there. I thought you said let them know how long you've been here. Okay. Because that's more managing yourself up.
How much time you're going to take every day.
Gotcha. So that's exactly right. So how often do you do your AIDIT with your patients? How many have patient contact? Okay. How many have staff contact? Okay. So how often do you do an AIDIT with your patients?
Every time.
Okay, every time. And how well do you manage up yourself or something about the hospital?
I hope we try to stay positive, because in some cases when we educate, there are some physicians that they aren't always as engaged as others, but even when you go in and for example, if I'm doing orphan education and I've had to call a doctor because I can't get him to call me back and whatever else, and they'll say this is my preceptor, even though he may be a problem to have to deal with, I always try to reassure that they're still getting very good care and just try to make sure that we educate to the best situation possible and make everything positive.
Okay. How do you do that?
I always, after I introduce myself and talk all that, I tell patients that we want to always find out that we want to talk to everybody who's on specifically their class of med. So everybody who's on an anticoagulant, we want to come up and talk to you, even though you've been on it forever. We want to know if you have any questions. But mostly I'd say impress upon them that we want to know about what they're on and what they know about what they're on.
Okay. Okay. Good. And as far as you interact with staff, right? So constantly. So you're not necessarily going to go around and manage up yourself. Oh, by the way, I'm coming here to deliver your medicine. I've been here for 15. You're not going to say that, right? That's just ridiculous. But what can you do to create a positive working environment on the floors? How do you do that?
Just like try to have good relationships with the nursing staff.
What does that look like? What does a good relationship look like?
Dealing with people that should know how to open a Pyxis QB and can't.
Finding the stuff in the refrigerator that always looks in the refrigerator, even though we forgot to look before we call.
So what do you do with those people?
Teach again.
Okay? And how do we do that in a kind, compassionate way without having an attitude?
Just remind them that where other things can live, but if in these cases that it's refrigerated, that we have to make it in the, for example, if it's in the refrigerator, it's probably something that we have to make in the hood, so I usually just try to tell them a little bit about why it's in the refrigerator, and that's where they can expect to find it.
So you're educating them along the way?
Try to.
Try to. Do nursing staff ever give you attitude?
Oh, yeah.
Okay. What do you do with that? Do you just take it?
Usually, yeah. Just try to be kind back to them. Your inclination is to be snarky.
Oh yeah,
back
for
to
sure.
them
I'd
or
be
whatever.
snarky back
Yeah.
sometimes, for sure. So that's good. That's good. I like honesty. So yeah, you try to be kind back because you want to model good behavior, right? So, but what happens for you all if it's the same nurse over and over treating you badly? What do you do with that? Please don't tell me you just keep taking it.
Avoid that.
There you go. I like the honesty again. Avoid him.
Are you
So-
getting all this on tape? Because this is really, really helpful.
So we wouldn't avoid it, and we wouldn't just sort of take it either, because what are we trying to do here? Aid It is about just what you said: acknowledging, introducing, talking about duration, talking about explaining, and talking about thank you. That's Aid It. But in reality, Aid It is about culture, right? Aid It is about making sure we're treating everyone with that kindness and that compassion and that respect. And that's how Aid It helps with that culture. It helps develop that culture. So if you have a nursing employee who continues to be mean to you, that means we have a low-performing nurse, right? Would you not say? I mean, if it was opposite and you were going up to the nursing floor and you were treating them rudely and badly, would we not consider you a lower performer? For sure. So why are we letting nursing have low performers, but we can't have them in pharmacy or other places? So with that information, you would go to your infamous Jason or supervisor. You oversee, who oversees you guys as techs?
Whoever's on the front end usually.
Okay, because you don't have an absolute supervisor who, okay. So I would go to Jason and just let him know what's going on. Because when you're not saying anything, what are you perpetuating?
You're going that way, okay?
You're perpetuating a bad culture. And you guys are a key element to this organization. You can't allow bad culture to continue. You're going to have to take accountability and do something about it, okay? That doesn't mean going and confronting Susie, the bad nurse. It probably may not even, if you're not comfortable, going and talking to her director or her manager. But you can talk to Jason and let Jason know and have examples of specifics of what that nurse is saying or doing, and let him deal with the director or the manager. Make sense? So Aid It's about a culture, and you're right. Acknowledge, introduce, duration, explain, and thank you. How do you guys manage yourselves up or manage your organization up when you go to the nursing unit and you talk with the patient? What do I mean by manage up? Does anyone know?
Mostly instead of just taking a negative attitude, trying to take something positive and use it for teaching and expanding, I don't know.
Nope. When I talk about manage up, I mean talking about and saying something positive about yourself or the organization. So I'll give you an example. Knock, knock, knock. Hi, my name is Debbie. I'm one of the pharmacists here. Well, actually, knock, knock, knock. Hi, Mrs. Jones. This is Debbie, one of the pharmacists here. I'm coming in to do some teaching with you about your medication. I just want you to know that I'm gonna make sure that you have a great experience and that we're gonna do everything we can to provide you with excellent care. Or, hey, my name is Debbie, I'm one of the pharmacists here, and I just want you to know I've been here for about 15 years, and I know all about this Coumadin stuff, and I'm gonna make sure that you understand it before you leave. Managing up is managing yourself up. Sometimes you manage yourself up by telling them how long you've been here. I've dealt with this medication a lot, I really understand, whatever it might be. Or managing up is when you go into the room talking about, hey, I see Jackie as your nurse today. Jackie's such a great nurse, you're gonna have a great day. So let's talk about that Coumadin now. I wanna make sure that you understand everything you need to know about that Coumadin before you go home, because it's important for your safety that you understand what this medication's for and some of the side effects. Now, how do you think you guys impact the overall HCAHPS score of understanding their medications and side effects of their medications? Do you think you impact that score?
I think to some degree, yes.
Now, you don't see every patient, right?
No, we don't.
See, how many patients what patients are you usually seeing?
Mostly people who are on anticoags
Okay.
or antiarrhythmics
Okay.
or
It's a fair number.
Sometimes for
newer,
measures patients.
Poor measure patients. Okay.
newer drugs that are problem drugs,
Okay.
which are usually antiarrhythmics.
Okay.
Anything, if a physician puts a consult, if they want specific education, they'll consult for what they want.
Okay. So on average, how many patients do you think you're going up and counseling a day?
Probably anywhere from 4 to 15.
4 to 15, okay. So why that's important, why I say, and one of the things we know in huddles, we had just talked about today, is knowing how you as your department can impact the actual scores. You can impact that medication score. You can help reinforce what the nursing maybe has talked about or maybe hasn't talked about. Let's be serious here, let's be honest. Do you think nursing's going in every time and talking about medications? No. Should they? Yes, but they're not. I don't know one hospital who nurses do that every single time. So you're there to help reinforce it. You're there to help talk about and use some keywords around when you're doing some counseling. So some of those keywords are, we want to make sure that you're safe. We want to make sure that you understand the side effects of your medication. Actually saying the word side effects, actually saying the word safety, those are really key things for you all to say and to enforce to your patient. So when you're talking to them and explaining the drug and explaining what's going on and how they should take it and how it's dosed and what are some of the things they should be looking for, instead of saying, here are some of the things you should be looking for when you take the medication, say the word side effects. Who says side effects? Do you say side effects? Awesome. So you're helping reinforce what the nursing staff is really struggling with. They're struggling with that side effect piece. Do you ever talk about patient safety? What do you usually say? Relate to patient safety.
It usually depends on the patient, but talking to them about the safety and making sure that they take their doses appropriate on time, or if they're having any interactions, I usually ask them if they've had any problems in the past, or if they're currently having any issues with it. I usually open it up, even if I'm specific on one drug, ask them if there's anything or concerns that they have with any of their meds while they're out there.
Sure. Okay. Safety, okay, good. How about you? Do you include safety at all in your
Oh, yeah,
discussion?
well, mostly, we really try to stress all the things that can go wrong if you're on Coumadin. So that's mostly what I'm talking about is the safety, and we stress with them that we want them to know when there's a problem. So, I might not say safer, but every time we say, we want you to know, if you have pink saliva, blah, 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 everything down the road that your body does not like the dose you're getting. You don't say you're on the wrong dose.
Right.
I try to explain things to their body.
They need
So
to
we
be aware.
mostly, and mostly on, and all the others too, we stress the safety of them telling anybody they come across that's in the medical field that they're on those,
Good.
just so they don't have to worry. Yeah, it's a pretty well scripted thing. mostly safety oriented, I think.
Okay, and it may be safety oriented, that's great, and it should be, of course it is. I want you to start incorporating the word safe in there somewhere. I don't care where you say it, I don't care how, just somewhere, your safety is important, or safety is key for us here, we want to make sure that you always stay safe. Those type of things are really important to start including into your language, into your discussion with the patients, okay? So safety and the managing up yourself, the staff, the hospital. Hey, you know, I'm coming here to do some education about this medication. When you're leaving, you can always say, hey, thank you so much for listening, or thank you for your time, and thank you for also choosing Great Plains Health. We always want to take great care of you here. Is there anything else I can do for you before I leave? And they may say, yeah, I need to go to the bathroom. So what do you do then?
Depends on, usually as you have them call the nurse, or if the nurses, if they've been trying to call, just escalate to get somebody, make sure that if they're like fall risks, that they've got their gate belts and everything for safety, and just ask them, tell them for their safety, you need to get some assistance.
So it's important that you all, if the patient says, hey, I need to go to the bathroom, you say, you know what, I'm not able to help you with that, but I'm going to go make sure I find the nurse right now to help you, the nurse or the tech to help you, and then go find them. Take the 3 minutes to find them, or find someone, because you've now left that room, that patient is sitting there, and if you're just putting on the call light or telling the patient to put on the call light, it could be a little bit of time. You need to escalate it, because they've gained your trust, right? You've sat in there with them, you've discussed the medication with them, they've gained some trust. So don't let them lose that trust. Make sure that you're going back and you're finding the nurse. And then if you're still on the floor and it's been 10 minutes and you walk past the room and you still see the patient laying in bed, you might want to pop your head and say, hey, I'm just checking to check to make sure that nurse got to you. And that they say no, now you're going to escalate it. You're going to find that manager, you're going to find that charge nurse, and you're going to escalate it. That's important. That's where you guys come in and we work as a team and not just individual silos, but we're all there to make sure that that patient gets what they need. Make sense? Now, for the technicians, you know, you're maybe not doing all of that aided, but you're going to go ahead and make sure that you know, the staff knows that you're there for them, that you're there to help them, and communicating in the way that can be helpful. And I'm sure you explained to them, like you just did, about where the medication is, why maybe, hey, you called me, but if you can see here, the medication is here because blah, 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 blah. So I'm sure you're explaining it to your fellow coworkers that way. What do you answer the phone to in pharmacy? So how do you answer the phone? What do you say when you answer the phone?
Name and may I help you, or how can I help you?
Okay. Hi, this is Jim. Can I help you? Good. Would you be surprised? There's a lot of people who don't use their name. Pharmacy.
I have a guy that impresses me every time, Nurse BJ. I mean, I can call him 20 times in the day and he'll say, good morning, this is BJ on Critical Care West. How may I help you?
Beautiful.
He's the best example. Like, hey, you know it's me. But he does it every time.
It's beautiful. And why does he do that every time? Because it becomes part of just what he does. It becomes consistency.
I heard it all weekend long ago.
But that's what we want. We want
Yeah, I know.
consistency from our staff, so our patients see that consistency. When the patients start seeing consistent and hear consistent things from everyone in the hospital, that's when they start putting all the dots, connecting the dots, and then when they get this lovely survey in the mail and they see it and they're like, oh yeah, the staff always, yeah, they did that a lot. They did that. Yeah, they talked about side effects. Yeah, they talked about safety. So those dots start to connect for the patient. And that's why it's so important. So you never want to answer the phone, hey, pharmacy, can I help you? No, hey, good morning, this is Debbie. It'd be great even if you said in pharmacy, hey, this is Debbie in pharmacy, can I help you? Boom, simple. But say your name. There's a lot of places who don't.
I usually say the department first and then identify who I am, because sometimes with the responder 5, that first couple of seconds doesn't always transmit, so if I say my name second, I usually just say what department. It's frustrating if you call and somebody barely says hello and you don't know if you're talking to who
I agree.
you need to talk to.
I agree. That's great. Yep. Pharmacy, this is Debbie, can I help you? Yeah.
Perfect.
How can I help questions? Huddle. We have 2 minutes to talk about huddle. So huddle is something that we talked about today, and I know you guys already do a huddle, right? You do it every day?
Yes.
Okay. Religiously?
Yes.
Okay. There's a couple of things that probably are going to be the focus. We're going to change your huddle up a little bit. We're going to start off with really talking about some things that are going well in your department. Why do we start talking about maybe wins or things that go well before we start digging into other stuff? Why would we do
You
that?
just go downhill once
Set
you
a
start
positive
going.
tone.
Set a positive tone, because us as healthcare professionals, we think negative all the time. Everything's, woe is us, you know, the sun's out, but the wind is too high, and, I mean, woe is us, right? Right. So we want to start out with the positive. Another thing that we're going to focus on is some of the HCAHPS scores. So actually for you all, looking at some of the nurses' HCAHPS scores related to medication, explaining medication, you're going to see what that score is on a regular basis and see how you can help impact that. Or just that knowledge of that score will help you. It may also be some other scores that are brought up or some other things about HCAHPS that are brought up. But that's another focus of the huddle that will be happening going forward. What else, Jason?
Yeah, with the huddle, we want to report the HCAHPS scores on a more routine basis.
Yes.
Even though that data is quite old, at least a quarter old, it takes 6 weeks sometimes to get the patient interviewed, so we may be 4 or 5 months out before what we do today actually impacts those scores.
For sure.
4 or 5 months down the road when it's reported.
For sure.
So we need to just keep that in mind too, that it's a long-term view and that we need to keep the consistency of what we're doing and just continue to improve on that. So we'll be taking a look at that more frequently in our huddles.
Perfect. Perfect. Exactly. Anything else? Okay. Videotape done.